Good evening. Let me first and foremost thank the World Health Summit, particularly Professor Fukuhara and also Professor Ganton for the kind invitation. And of course, it's so good again to meet you, Minister Herman Gruet. Thank you for organizing the G7 Health Ministers meeting where we spent 2 days together to discuss some very important subjects. Honorable ministers, friends, colleagues, ladies and gentlemen, let me explain a little bit before I go to my speech. I have a strange voice today. Normally, my voice is much more beautiful because I can sing. But I could not resist because I have been to Berlin many times. But this is the only time I managed to have a weekend. And I could not resist to go out and enjoy the beauty of this city. And in so doing, I did not come well prepared for the cold weather. I managed to catch a cold. But that's okay. I'm still able to maintain my voice because I was taking medicines, thanks to you doctors, for keeping me in good health so that I can attend this very important meeting. The World Health Summit, ladies and gentlemen, is truly a premier strategic forum for global health leaders to come together. Global health leaders from different parts of the world, but also from every field in health, where they come together, be they experts, scientists, academics, civil society leaders, industry, or political leaders who make very important policy decisions. This is a wonderful forum where you can exchange ideas, exchange best practices. Your excellent work from science provide the evidence to inform policy. And I like what Professor said, action. Part of the problem in this world is leaders overpromise and under-action and underperform. And let me now share with you some of the challenges as well as opportunity going forward in 21st century. The world has changed dramatically since the start of this century. With the Millennium Development Goals, we call it MDG, it became the focus of international efforts to reduce human misery. At that time, human misery was thought to be, a discrete set of principal reasons, causes like poverty, hunger, poor water and sanitation, several infectious diseases, and lack of essential care during pregnancy, childbirth, or childhood. The results of that focus, I have to say that, leaders of the world, working together, unleash the energy, the resources, and the innovations to help so many people in this part of the world. And the outcome was the best, the wildest dream of many. It demonstrated the power of international solidarity, public health, and working with the private sector, what we call PPP, public-private partnership. They brought out the best of human nature. Just to give you some statistics to prove the point, maternal and child mortality fell at the fastest rate in history, with some of the sharpest drop recorded in sub-Saharan Africa. Each day, 17,000 fewer children die than in the 1990s. AIDS reached a tipping point in 2014 when the number of people newly receiving antiretroviral therapy surpassed the number of new infections. Since the start of the century, an estimated of 37 million lives were saved by effective diagnosis and treatment of tuberculosis. Over the same period, deaths from malaria declined by 60%. An estimated 6.2 million lives, mainly in young African children, were saved. Drug donations by the pharmaceutical industry allowed WHO to reach as many as more than 800 million people. Not 80 million, not 8 million, it's 800 million people every year with preventive therapy for river blindness, lymphatic filariasis, schistosomiasis, and other neglected tropical diseases. How many of you can read those names? very few. And truly, this is a group of what we call ancient, debilitating diseases that anchor, that shackle people, more than 1 billion of them, in poverty. And I want to thank, Chancellor Merkel and, of course, other leaders in this government for putting neglected tropical disease on the global agenda and bring attention to this. If we believe in poverty reduction, we must address neglected tropical diseases because they anchor women, children in poverty. More than 1.5 billion out of the 7 billion population is a big number. I want to also thank the industry for their generosity. I've been talking to CEOs of many pharmaceutical companies. They said to me, Margaret, we will provide to you, free of charge, the medicines you need for children to make sure that the worms in their tummy are taken care of so that they can benefit from this, education system. We will give you the medicine so that women do not need to suffer from elephantiasis, so that they could not get married and men could not get a job. This is the kind of partnership, this is the kind of solidarity we need to address global challenges. Last month, the United Nations General Assembly finalized a new agenda for sustainable development. The number of goals, SDG we call it, has grown from 8 to 17, and including goal number 3 for health, the related targets increased by 8-fold, from 21 to 169 targets. Now, before I go on, I was very happy 2 weeks ago, together with Chancellor Merkel and others, to celebrate, the passage and adoption of the SDG. But the question I have now is, I don't want to come back here 10 years later to say that we did not implement them. So we need you, especially young people, civil society group, to make sure leaders walk their talk, keep their promises by implementing what they have adopted. Now, ladies and gentlemen, going forward, we are living in a very, very different world. The factors that now govern the well-being of human conditions and the planet that sustains it are no longer so discrete. This is a world that is seeing not the best in human nature, but the worst. International terrorism, senseless mass shootings, bombings in markets and places of worship, ancient and priceless archaeological sites reduced to rubble, and the seemingly endless armed conflicts that have contributed to the worst refugee crisis since the end of the Second World War. Let me once again commend, the German leadership for showing, the world, especially in this region, that in solidarity with all these people who are seeking a better future, from countries or fleeing from their countries of conflict and insecurity, you are doing your really best. I know that there are different viewpoints in this country, but when you move ahead of the curve, when you are way ahead of the pack, you will hear different voices. Be courageous. Don't worry about that. We need criticism, yes. But we need to support her leadership. You know which one I mean. So, friends, colleagues, since the start of this century, there are some newer threats to health that gain prominence. Like the other problems that I have just mentioned that affect humanity's prospect for a sustainable future, these newer threats to health are much bigger and more complex than the problems that dominated in the health agenda in the last 15 years. All around the world, health is being shaped by the same powerful forces like population aging, rapid urbanization, and globalized marketing of unhealthy products. Under the pressure of these forces, chronic non-communicable diseases have overtaken infectious diseases as the world's biggest killers. This shift in the disease burden has profound implications. It challenges the very way socio-economic progress is defined. Beginning in the 19th century, improvement in hygiene and living conditions were followed by vast improvements in the health status and life expectancies of people in many countries. These environmental improvements help the control of infectious diseases as well. And many of the diseases will vanish, from modern societies. But today, ladies and gentlemen, the tables are turned. Instead of diseases vanishing as living conditions improve, socio-economic progress is actually creating the conditions that favor the rise of non-communicable diseases. Economic growth, modernization, and urbanization have opened very wide the entry point for the spread of unhealthy lifestyles. The world truly is ill-prepared to cope with NCDs. Very few health systems were built to manage chronic or lifelong conditions. Even fewer doctors were trained to prevent them. Doctors treat the heart, another doctor treat, diabetes, maybe another doctor treat the lung disease. As we said, when you get to a certain age, maybe no matter how well you do in prevention and having a healthy lifestyle, you may have comorbidities, meaning several conditions, affecting your health. But you don't have to be a cripple. You can be healthy, provided doctors take care of you as a human being. Take the perspective of people-centered care instead of treating their patients as a collection of organs. I keep making this point. Going forward, we have made tremendous success with the vertical program of HIV, TB, malaria, maternal and child health. But I think the time has come. The time has come for us to bring all these together through a comprehensive, integrated, and affordable system of universal health coverage, making sure that no woman, children, or man, are denied access to care because they are poor. Make sure that people are not denied access to life-saving commodities because they are poor. So let me just give you a few statistics to illustrate the important point about the cost of treating NCDs. In some countries, treating diabetes alone absorbs some 25 to 50% of the entire health budget. So what is left? Not much. And as a reason, the Lancet Oncology Commission concluded the cost of cancer therapy are becoming unaffordable even for the wealthiest countries in the world. Many newly approved cancer medicines cost more than $120,000 per person per year. And that is the economic reality. How many countries can afford that? Of course, another new threat, the climate is changing. WHO's recent estimates that air pollution kills around 7 million people each year. It has finally, this kind of powerful statistics, given health a place in the debates about the consequences of climate change. Worldwide, this past July was the hottest since at least 1880, when records began. This year's thousands of deaths associated with heat wave in India and Pakistan provide further headline evidence of the health effects of extreme weather events. Another challenge, antimicrobial resistance, which was also alluded to by Minister Herman and also, the leadership of this country along with the G7 leaders to take this issue head on. And this is an issue where multi-sectoral collaboration is critical, involving the scientists, the PDP, the industry, and others coming together to find the solutions. We warmly welcome, WHO warmly welcomes the G7 Health Ministers' declaration and the commitment it takes to address AMR in its multiple dimensions. Ladies and gentlemen, no one working in public health should underestimate the challenges that lie ahead. These newer threats to health do not neatly fit the biomedical model that has historically guided public health responses. Their root causes lie outside the traditional domain of public health. The health sector acting alone cannot protect children from the marketing of unhealthy foods and beverages, cannot persuade countries to reduce their greenhouse gas emissions, or get industrialized food producers to reduce their massive use of antibiotics. The newer threats to health also lie beyond the traditional domain of sovereign nations, accustomed to governing what happens in their territories. In a world of radically increased interdependence, all of these newer threats are what we call transboundary threats. They don't need visas to cross boundaries. Like you and I, when we travel, we do need visas, right? The globalized marketing of unhealthy products respects no borders, and by definition, a changing climate affects the entire planet. And as very clearly illustrated by malaria, TB, and bacteria carrying the NDM1 enzyme, drug-resistant pathogens are notorious globetrotters. They travel well in infected air passengers and through global trade in food. In addition, the growth of medical tourism has accelerated. The international spread of hospital-acquired infections that are frequently resistant to multiple drugs. And I'm sure you have heard of such name as superbugs, not superdrugs. We need superdrugs for superbugs. We face other challenges as well. Poverty. The poverty map has changed today. 70% of the world's poor people live in middle-income countries. And this is a game-changing statistics. Growth in GDP has long been the yardstick for measuring national progress. We need to be careful. The world does not need any more rich countries full of poor people. Our world is profoundly interconnected, and this too has consequences. Minister Herman already mentioned the importance of the refugee crisis in Europe. That shattered the notion that wars in faraway lands will stay remote. There's no delinking. The Ebola outbreak shattered the notion that a disease of poor African nations will have no consequences elsewhere. So, ladies and gentlemen, in the most dramatic and tragic way possible, the Ebola outbreak focused international attention on the need to invest in health systems, especially in fragile and vulnerable countries. And I want to thank the G7 leaders. You have collectively committed to help 60 countries in the world to build international health regulation capacities as an integral part of strengthening of health system. This will pave the world in a better way to be prepared for the next crisis. We also welcome the G7 commitment to act on lessons learned from Ebola. And I welcome in particular the emphasis it places on strengthening health system as the first line of defense against infectious disease threat. And that is a responsibility of every government with the support of development partners like the G7 leaders. No countries. I'm sure the people in Germany, you don't want to forever provide ODA, do you? You teach them to fish instead of giving them fish every day. And this is the mentality. We need to demand results for the resources that contributors are making, and making sure that the money goes to where it makes the biggest impact instead of going to Geneva. You know what I mean? As noted in the G7 declaration, is very important. The goal is to build resilient and sustainable health systems that offer quality, comprehensive care and aim to progressively achieve universal health coverage. As I said, if truly SDG is about leaving no one behind, making sure that everyone share prosperity, we must make sure we deliver on that. As I said, global health initiatives like Global Fund and Gavi, they have done extremely well and brought spectacular results. But when they go to countries to help these developing countries, when they are confronted with very weak health systems, these global initiatives often build their own parallel systems for procurement, for delivery, for financial management and reporting, resulting in duplication and fragmenting further already weak health systems in many countries. This has to change. We must all work together to provide primary health care, people-centered primary health care based on primarily prevention. And I'm happy to hear that there will be insurance companies, industry here to share with us. You know, if we don't make changes, we are not sustainable. No country can afford the way going forward without addressing integrated care, without addressing prevention and promoting healthy lifestyles. And let me finish by just quoting a very important declaration by 267 prominent economists from 44 countries. This declaration was published in The Lancet. It urges global leaders to prioritize a poor pathway to universal health coverage as an essential pillar for sustainable development. Universal health coverage transforms livelihoods as well as lives and works as a poverty reduction strategy. This is a wonderful opportunity for us to move forward to achieve the 17 goals in an integrated manner, and in health in particular, all the goals that we are going to implement because they have already been agreed by leaders of the world. They need a functioning, resilient health system in order to deliver all the goals and beyond. So, ladies and gentlemen, universal health coverage protects people, protects community when crises occur, whether these are crises arising from a changing climate, arising from NCD, or arising from a runaway virus. Universal health coverage, under normal conditions, will build coherence and stable society that underpins economic productivity. And these are the valuable assets we all treasure. So let me once again thank you for your kind attention. Let's implement, let's walk our talk, let's implement by action. No more empty promises going forward. Thank you.